Hi, I'm Dr. Michael Wosnick, and I'm privileged to be the Vice President of Research for the Canadian Cancer Society nationally, and also the Scientific Director of the Society's Research Institute. We're bringing you this video message today because we wanted to give you a ringside seat on some really exciting news that's coming out of a big meeting in Chicago. It's a meeting of the American Society of Clinical Oncology, or ASCO for short. Now, ASCO's annual meeting attracts something on the order of perhaps 35 or 40,000 clinicians and oncologists from around the globe. And they gather once a year to exchange information, to learn about best practices, to see where the breakthroughs are coming, and so on. It's a very important and a very powerful meeting. And every year there are about perhaps 8,000 investigators that want to present their data at ASCO because it's a platform that they really want to be present at. And every year, perhaps 1% of those 8,000 are chosen by the organizers to be what's called the best of ASCO. And I'm proud to stand here and tell you that this year, not one, not two, but 3 different studies led here in Canada by the Canadian Cancer Society supported clinical trials group have made that designation of best of ASCO. 2 of them have already been presented over the last 2 days. And both of those actually were further honored by being in the ASCO press conference. So these are presentations that the organizers believed need to be disseminated to the public as quickly as possible because these are really breakthroughs. And that's why we wanted to give you this ringside seat to be able to learn a little bit about that. One of them was even published immediately in the very prestigious New England Journal of Medicine. That's how powerful this study was. Why? Because the particular study that I want to tell you about is one in breast cancer, and it's a study of a new drug called exemestane. Now, exemestane has been shown now in this study to be able to prevent breast cancer. Not treat it, not cure it, prevent it. And so this is a study where postmenopausal women who were at higher than average risk of developing breast cancer were given this particular drug, and after 3 years of follow-up, almost 65% reduction in the occurrence of breast cancer was the result of this study. It was supposed to go for 5 years. It wasn't even necessary to go for the full 5. It was stopped at 3 because we'd already proved the result that we were looking for. 65% reduction in the occurrence of breast cancer. Think about what that means. Imagine if you know 3 women who are at increased risk of breast cancer, taking a pill a day. 2 out of the 3 of those will avoid the agony of breast cancer in the first place. That's a dramatic result. That's the kind of thing that you just don't see every day. This is a huge breakthrough, and it would not have happened were it not for donor dollars supporting the Cancer Society, supporting the clinical trials group, and here we've taken center stage on the world. I know I've thrown a lot of things at you in the last couple of minutes, so let me just step back and go to the bottom line of all of this. Because of this study and your support of this study, thousands and thousands of women around the world will be spared the pain and suffering of breast cancer. On behalf of those women, on behalf of their families, on behalf of their caregivers, on behalf of the oncologists who treat them and look after them, we owe every one of you more of a vote of thanks than a simple video could ever do. Without you, this doesn't happen. I can't thank you enough on behalf of everyone around the world who will be impacted by this trial. Thank you.